Thank you very much for that introduction, Wendy. So good afternoon. Today, as Wendy explained, I'm going to speak to you about positioning and handling with a post-operative and neurological and orthopaedic patient. Essentially, the aims of today's session are to explore the situations in which a veterinary patient may be unable to change their position, and to just develop a bit of an awareness and discuss the kind of problems that can be caused by poor positioning. It's something that we focus on quite heavily in the NHS with people, and it's something that is becoming more of an issue now in veterinary management. We'll also discuss a little bit about the manual handling precautions that should be employed when you're handling patients, and we'll have a quick look as well at slings, harnesses and hoists. So why change position? It's something that we all do regularly, but why is that? And there's a few various different reasons in terms of why we need to change position. So for one is the maintenance of circulation. If we maintain a particular position for any sustained period of time, you can get pooling of blood in the position in the dependent area, depending on how you are positioned or how an animal is positioned. And if the animal has had surgery or has edema or swelling for any particular reason, the circulation pooling can cause swelling to build up in that same area as well. So it's quite important that we would regularly change position, and it's something that our bodies are inbuilt to do subconsciously, and as are animals, but there are obviously occasions when animals can't change their own position. So we need to change position to also maintain tissue integrity, and therefore preventing pressure sores. And pressure sores is something that we'll talk about shortly on in the presentation. It's something that it's becoming more of an issue purely because we are able to treat animals with a greater depth of an issue, so more significant neurological lesions, for example, or we're able to treat animals that may have undergone a more significant amount of trauma because veterinary skills have advanced, obviously, as the years have gone on. Those animals that may have previously been put down we're now able to treat, but therefore they will remain recumbent potentially, or not as ambulatory as usual for a longer period of time. So we are therefore coming up against a little bit of the tissue integrity being compromised. Periods of cage rest, for example, can induce that. We also need to change position frequently to alleviate joint stiffness, certainly in the ageing animal or equally in the ageing person. And the longer you keep a joint still, you get an inflammatory buildup of fluid within the joint capsule, and that can make the joints quite stiff and quite sore. I don't know if any of you out there have back pain. I'm sure maybe the odd one of you or two do, but if you spend longer in bed overnight, trying to get up first thing in the morning, if you've stayed still for a prolonged period of time, is more painful, and you do always feel a bit stiff when you first get up and get going. And it's really changing the position frequently helps to reduce that happening. It helps to prevent muscle and tendon and tissue shortening. This one is probably less of an issue. It's more in the examples of animals that have had a significant neurological lesion, for example, a brachial plexus disruption, where maybe they have lack of use of a particular limb, so the forelimb affected in the brachial plexus situation. If they are at rest for a prolonged period with that limb staying in the same position all the time, you will get shortening eventually of the muscle bellies, the tendons, and if there's been any scarring in that area as well, that scar tissue will be allowed to shorten, therefore may restrict future joint range of motion. So it's quite important to try and continually change the position in those kind of patients to prevent that shortening happening. And so just as we said a little bit before, what prevents position change? There are lots of different things. This is by no means an exhaustive list, but it's just to give you a few different scenarios in which an animal or a person, to be fair, may be prevented from changing their position. So if they're non-ambulatory due to medication, the most significant situation for this would be immediately post-operatively, or obviously if the animal is still quite groggy from its anaesthetic, sleeping the anaesthetic off. If they are not moving around their cage or kennel or crate for quite a period of time, they will potentially get quite stiff and sore. If they have pain, it may prevent them changing their position regularly. Similarly, significant trauma, if they have, for example, several limbs that are broken or restricted in some way. If they have an existing soft tissue contracture, that will prevent them from changing their position. as will neurological deficit, and that's deficit really whether it's upper motor neuron or lower motor neuron. If they're unaware of where that body part is, they may leave it in a position of risk and not really be aware that there's either a pressure build-up or it's starting to feel uncomfortable if they can't feel the limb as normal. Splints, bandages, casts, attachments. I've put attachments really as quite a global one. All of the above will reduce the amount in which an animal can move if they are attached by means of an IV line, or if they have any other tubes, feeding tubes, or any kind of ventilation equipment in situ. All of the above will prevent how they can normally change their position, and it may be that they feel uncomfortable, but they are restricted by whatever is attached to them, so they're not able to make themselves more comfortable. If they have a lack of space, if they are within a fairly small crate for rehab purposes, if they have to remain cage rested because of whatever issue they have wrong with them, whatever they've undergone, surgery or trauma or neurological issue, having that lack of space will cause them to therefore maintain the same position for quite a long time, and it may prevent them as well from taking their joints through full range of motion. So if they're unable to stand up properly because the cage is too low, this can cause them to get quite a lot of stiffness, and therefore it will also encourage them to stay in a lying position more often, just because that's all their space allows. That will then unfortunately put them at risk of pressure sores and joint stiffness, as we spoke about before. Similarly, thinking more about in the veterinary practice environment, if they're in a bedding, if they're on bedding or the kennel or cage lining that makes it quite tricky for them to move, if they can't quite get a grip and the kennel is lined with, for example, newspaper or vet bed, and that slips underneath them, it might, if they're quite weak or if they have a neurological deficit, it might prevent them from changing their position as they wish to, and prevent them from feeling completely comfortable. So it's something to be aware of really when you're putting an animal in a crate or a cage for whatever purposes. It's to make sure it's got a little bit of grip. Sometimes you can get a nice kind of rubber lining to the bases of the kennels or cages. Well, at least will give the animal a bit of purchase in order to be able to stand up or move if it wants to. So the first poll question then, could I ask if anybody, do you have any protocols for pressure management at your veterinary practice at all? And that would be a yes, a no, or a not sure.
Thank you. I've just launched that poll, so if people could again just click on their screen which answer, yes, no, or not sure. And even if you're on a tablet device, you should be able to select which answer. If it's not working, do just type your answer into the question box for me. And we've got nearly everybody voted now, so I shall close that poll for you. And the results, believe it or not, 33% say yes, 33% say no, and surprisingly 33% say not sure.
Well, it's excellent to hear that 33% is yes, and that's really good that people are aware of pressure management. Like I said, it's something that's drummed home within hospitals, and it never used to really be an issue in veterinary practice purely because animals weren't recumbent for long enough, but now we're able to treat more complex things. That's really good that practices are therefore aware of the situation. The second poll question then linking on to that would be, if you have got a protocol, do you have any specific objective markers for pressure monitoring? That'd be a yes or a no, and by that really I mean, do you have a standardised checklist, for example, of things you look for, or is it just an objective, well, more of a subjective view if you're looking at the patient within its kennel environment?
And on that one, we have 100% of people have said no, they don't have a protocol for using any objective markers.
Okay, no problem. There are lots of different protocols around that, many of which have been research based. I think certainly from the looking around that I could do, most of them were human based. There was only one I found that was from a more of a veterinary perspective, and it wasn't particularly in depth, if I'm honest, but certainly all the theory and the science behind pressure areas, tissue viability, and sort of breakdown of tissue integrity can all be sort of almost directly translated over to veterinary medicine, especially because many of the areas we will be worrying about, you will be able to see any changes because they may have had their hair shaved, for example, or it may be a particularly bony point where it's easy to sort of see through the fur in terms of any pressure that's occurring. So if you don't have a standard protocol then for your veterinary practice, it would be worth, I think, employing one. And